Hello, and welcome to the Smart Injury Doctors podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Doctors, I sometimes get asked now, what's the fastest way to grow a spinal injury practice? Because a lot of providers in the market are becoming acutely aware of the fact that a spinal injury patient can generate you sometimes 5 to 10 times the clinic revenue that a non-injury patient can generate in the clinic. Now, the nice thing about it, that this spinal injury patient, is you're also never dealing with financial consults, really. You're never putting the patient or their family in financial stress because typically they're not paying anything out of pocket. Typically their care is all covered by insurance. So, you're not having those conversations, or it's covered by a third party settlement with the attorney. So you're not dealing with putting the patient under financial stress. And the nice thing is you get to do everything in your power, all your magic, all your sauce, all your procedures, all your technique, all your different modalities you get to use to do one thing: get better patient results. So when doctors say, Dr. Kronk, what's the fastest way to grow a spinal injury practice today? First and foremost is by getting incredibly good clinical recovery results. That's what I did in my practice. So my primary focus in my practice was physical recovery results. I knew that I could get better physical recovery results than any other doctor in my area, or at least I believed that in my mind. Now, I believed that in my mind because I understood the injuries themselves. I understood what they look like. I understood how to work them up. I understood that there was only 3 of them when it came to spinal injuries themselves. And so I understood how to standardly work them up. And once I did, it changed my practice forever. And my practice was as busy as I wanted to be. Right? So the first thing, though, primarily, if you want to grow a spinal injury practice, if you want to grow any business, I want you to think, if you're in the automotive business and you get crappy results with engine repair, you're not going to do well in the market. So if you're a spinal injury clinic and you get crappy results, and there are plenty of clinics in the spinal injury market that get crappy results. There are clinics within the spinal injury market that I would not refer anything into. They're so bad. Their primary focus is not on patient results. And I can't wait. At some point in the future, clinic results should be just about anything that matters, just like automotive results. If you could have an app or an AI app that says, hey, if you go to this automotive center, they have a 96% first-time repair rate, and they come in at, in average under quote. You'd go, wow, this is incredible. That's where I'm going. If people understood where they can get great physical recovery results on a consistent basis, that's where they're going to choose to go. So if you can get good, consistent injury recovery results, 2 things. 1, you should be one of the highest paid doctors in your market because you should be busy. You should have a moral and ethical responsibility to make sure that your clinic is widely known in your local area. Everyone knows. Because quite frankly, the spinal injury market is so large. People think of the auto injury market. The home injury market is 5 times the size of the auto injury market. The public spaces market is 2 times the size of the auto injury market. So by the time you take home in public places, you're talking 7 times the size of the auto injury market. And the best doctors that treat injuries, acute injuries, should be where these patients are going. But a lot of doctors today simply don't know. 1, they don't know of the market, and 2, they really don't understand it. The biggest thing that most really good doctors have a problem with, and the biggest problem they have, is they just don't know what to do. They don't know how to enter this market. They don't know how to position and frame themselves to position themselves as the only logical choice for patients that have these injuries to treat with, and for other professionals like attorneys and medical specialists that need help. They need a place to refer these patients to. They don't know how to become the only logical choice. They don't know how to position that. That's marketing. That's internal marketing and external marketing. That's called clarifying your message and simplifying it, so people quickly understand exactly who you are and what you do. What is the service? What is your specialty? And so that's what we do. In Smart Injury Doctors program, look, doctors come now from all over the country to have me help them to simplify their understanding of the injuries. Once you simplify your understanding of spinal injuries, spinal injury documentation is some of the easiest documentation there is. I mean, if you like easy, if you like putting your feet up on the desk and coasting, then when it comes to a patient type in a clinic, that's your spinal injury patient. Now, I'm not talking about putting your feet up and coasting on results. You want to put the metal to the pedal on, like being consistently figuring out how to do better and better and better in that area. But as far as your documentation, it's easy. As far as the other medical legal requirements, they're easy. So I teach doctors how to simplify their understanding of all of those aspects, specifically of the injuries themselves. And then I teach them how to separate themselves out, how to position themselves out as the only logical choice in the market. And I do this to help them succeed. And they succeed using a proven, guaranteed system. And it's a system that we produced that makes you clinically right and legally tight very, very quickly. But it also shows you, the biggest thing that I'm the proudest of the program that I've created is it shows you this large, ginormous market. You don't have a clinic large enough to fulfill your local need. And a lot of you, like me for a long time in my own private practice, you're struggling to figure out, okay, new patients, new patients, new patients, new patients. Well, we show doctors there is no scarcity of new patients. You just have to position yourself so that they know you're there and you can fill the clinic. You got to have the largest headache clinic in the world based on personal injury information and personal injury procedures. So, it's not hard to if you can get great physical recovery results, it's not hard to market you. You're the easiest thing in the world to market. It's just you probably have, I don't know, you have timidness on marketing yourself, thinking it's yourself. What I'll tell you is that you have, a moral and an ethical responsibility, because patients don't need to go to mills. They don't need to go to substandard care centers. If you really can get the kind of results that I'm talking about, you should be extremely busy. And that's why I do these podcasts. That's why I do everything that I do in the Smart Injury Doctors program, and everything we do in our various programs is to help doctors understand how to get better patient physical recovery results, because that's the scarcity in the market. Look at the statistics. Statistically, a patient has a 55% chance or less. I mean, some of the statistics will show 88% of the people 10 years out still have the same problems that they had with the original accident. So statistically, the results in this market are terrible. And that is not from bad patients. That is from bad doctors. The majority of doctors in the spinal injury market don't even know what a spinal injury looks like. And if I said the majority of providers in the dog injury market don't know what a dog bite looks like, you would say, oh my God, that's crazy. And oh my God, would there be horrible results? But the majority of the doctors in the market today who are treating spinal injuries don't know what they look like. They can't actually say exactly what they look like. And if you're listening to this podcast and you're right now going, I don't know, I can't say what they actually look like either, well, I'm going to take you out of your pain and misery. A spine only has 3 parts to it. It's bone, disc, and ligaments. In order for a part to be damaged, it has to be deranged. So bones fracture, discs herniate, and ligaments hyperstretch, which causes excessive motion or instability. That's how you pick it up. That's what they look like. They look like fracture, excessive motion, or herniation, or combinations thereof. That's what a spinal injury looks like. Now, if you don't know how to work up a fracture, you're substandard. If you don't know how to work up a disc herniation, you're substandard. If you don't know how to work up a ligament injury, you're substandard. You have to know how to work these injuries up in order to get better results with them. If you don't know what they look like, how the hell would you know what to look for? And how could you definitely determine the severity of the condition? Remember, the severity of the condition is based on the severity of the derangement and the damage to the tissue therein. And in the spinal injury market, the spinal injuries themselves are so well documented. What symptoms do they cause? What is a surgical level of these 3 injuries in surgical guidelines? What are the permanency and permanency guidelines? What are the activity restrictions in activity restriction guidelines? What are the treatment guidelines in treatment guidelines? It's pretty easy. I mean, this stuff is so well documented. Doctors today, you don't have to argue. All you have to do is know your guidelines, know your clinical procedures, know what they look like, know how you worked them up, know what the diagnostics tell you, know what Nexus X-ray guidelines tell you, know what PCCRP, if you're a chiropractor, X-ray guidelines tell you, know what your ICA best practice guidelines tell you, know what the AMA guides the evaluation of permanent impairment tell you, know what Aetna, Cigna, Blue Cross Blue Shield, EVCOR surgical guidelines tell you, know what athletic return to play parameter guidelines tell you, know what your treatment guidelines. I mean, it's just know what Medscape says is the clinical indication. In other words, how do these things clinically present? If you have a spinal ligament injury, if you just go out to Medscape right now, go to Medscape when you're done with this podcast and go, hey, how does a cervical sprain clinically present itself? And look at the symptoms. Know that the TBI patient that's failing under care is generally not failing from the brain injury. They're failing from a thing called a cervical profile that's taught in every single concussion and TBI training, the majority of which the majority of doctors do not understand. That's a cervical ligament injury. That's a cervical instability that's causing it, not the TBI. Patients don't get help when the doctors are not treating the right thing. So if you're out there today and you can get great physical recovery results, trust me, you should be tripling and quadrupling your chronic revenue by replacing patients that you're currently seeing with high-value spinal injury patients. And if you don't understand that, I feel bad for you, but I feel worse for the people in your local market that could be coming to you and getting great results. And then you could learn to navigate this market easily. So that's all I have to say today is getting great clinic results is key to growing your business, just like any other business. Great service is the key. So doctors on these programs always, what I do is try to just riff on a point. You can listen to these in your car, listen while you're working out, to give you some motivation, to give you some drive in this area. Because again, these spinal injury patients will generally deliver about 5 to 10 times the clinic revenue. And so that provides freedom for you. That provides a level of freedom for you and your family. So one of the things that I do is we develop programs to help doctors get to the point where money is no longer a concern for them or their family. And the fastest way I know to do that is through the spinal injury route, through the spinal, through developing more spinal injury patients. So if you have questions about our program, call us at 727-306-2267 or go out to our website, smartinjurydoctors.com, and check us out. As always, I appreciate your time and your attention, and I appreciate what you do in this market, and I look forward to delivering more content on the next podcast.
You've been listening to the Smart Injury Doctors podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.